Okay, everybody, today we are going to go through the appendicular skeleton. I am going to go through, now the appendicular skeleton really is not a lot of slides. I think it's only about 39 or so. So this is going to be the appendages, all right? So that's where we get the appendicular skeleton from. So this is going to be 126 bones. This first lecture is going to focus on the upper extremity, okay? So the shoulder girdle, which is going to be the scapula and the clavicle, that's going to attach to or pretty much hang on to the rib cage, and then the bones of the upper arm. And then we'll talk about the lower girdle in the next video, which is going to talk about the os coxae, so the two pelvic hip bones, formed up of three bones that we'll talk about: the ilium, the ischium, and the pubis bone, and then the femur on down for the lower legs. So let's talk about our shoulder girdle. So when we talk about the upper pectoral girdle, we have the clavicle and we have the scapula, which is called the shoulder blade. For the clavicle, there's not too much to look at. All I want you guys to identify for the exam is the clavicle. Now, there are two ends to it. The flatter end of the two, and unfortunately, we don't see each other, so you won't get to hold the clavicle, but there's two distinct ends of the clavicle. There's a thick, rounded end, which is going to be the medial side that attaches to the manubrium, the sternal breastbone, and then the flatter end is going to join up with a part of the shoulder blade, the scapula, to form the acromioclavicular joint. The scapula is a little bit trickier. So with the scapula, you do need to identify a number of structures on the scapula, okay? So pretty much all of these are taggable for the exam. So we'll work through these a little bit. Let's see. Okay, so when we're looking at the shoulder blade and the scapula, this is going to sit on the posterior aspect. It's going to sit on the back of the rib cage. So when we're looking at it, there's going to be a distinct flat surface, and then there's one with a raised projection. This is the spine of the scapula. So you want to think of the shoulder blade or the scapula, that the spine runs like our spines, and it's going to be the more posterior structure. So that's how you're going to orient yourself to the shoulder blade. And I am going to show you on, so I did take apart Sven. I have his arm here. I left his other half at the office, so I'll have to show you how the shoulder blade sits on everything a little bit better. So when we're looking at the shoulder blade, you know what, I'm just gonna rip this apart. This is another structure that I found at my office. This is an old shoulder because Sven's scapulas are glued together. So here we have another shoulder blade. The clavicle is attached to it, so you could see, and I'll show you guys at the office when I have the other half of Sven there, but you'll be able to see how the clavicle and the shoulder blade form this pectoral complex. These rubber things are the ligaments that you don't have to know. So when we come across maybe I'll just rip this out so it's a little bit easier. There we go. So here we have our scapula, okay? But try to ignore the ligaments on the top. When you come across the scapula, you're gonna see two sides. There's this really flat side, and then we can see on the back, there's a side that has this raised projection. So you can see that really nice. The flat side is going to be the anterior side. This is what lays on your rib cage, right? And that makes sense. We wouldn't want this projection pushing against the back of our rib cage. So we know when we're looking at it that anterior and posterior sides. Then we want to know which side is facing laterally, facing outwards. So in that case, you want to look for a fossa. That's going to be this round projection here. And that is where the head of the humerus is going to articulate. Oh, you know what? I can use this head. So here's the head of a humerus, okay? And it's a ball and socket joint, and it is going to attach into the glenoid cavity or the glenoid fossa. So if you can find the fossa, and it's going to be the same thing with the os coxae for the hip bones, you'll see a cavity called the acetabulum. And that is going to be where the ball and socket for the femur is going to attach. So we know that this circular projection has to face outwards. So that would make this, and it's hard for you guys to see, this would be a right-sided shoulder blade. So this would be the medial side. And then everything is named on here. So looking at it, this is looking at it anteriorly. We have the superior angle, we have the inferior angle of the scapula. It's hard to see in here, but there is a scapular notch. It's just covered by a ligament at this point. And then if we look on the posterior aspect, we are going to have something called the spine of the scapula. So this is called the spine. The way I remember it is that as we work laterally, there's two raised projections. There's the acromion, and then there's the coracoid process. The spine of the scapula, if you follow it, becomes the acromion, and this is going to articulate with the clavicle. So if you can find the spine of the scapula and follow it, you're going to follow the acromion, and that means the more anterior structure is going to be the coracoid process. Coracoid process you guys can feel on yourself if you can find your collarbone and follow it out laterally. Where you get to the top of the collarbone, it's going to be the acromion and the acromioclavicular joint. If you find that joint and you drop down just underneath the clavicle, you should feel a bony projection. It will not feel very good. This hurts. So that's the coracoid process that you normally found. That's a large attachment site for a number of muscles and things like that. Okay, so we have the acromion, we have the coracoid process, we have the fossa or the glenoid cavity. They're both interchangeable. This is going to form the glenohumeral joint, also called the shoulder joint. And so after we identify our angles, our raised projections, the spine of the scapula, the acromion, which becomes part of the spine of the scapula, and the coracoid process, there's 3 fossa that you need to know. Remember, fossa is just a open kind of space. Sometimes the fossas are for joints, and other times they're for muscles. These ones are for muscles. So the part of the scapula that lays flat against the thoracic, the flat side, this is the subscapular fossa. This is going to be for the subscapularis muscle that we'll talk about in a few chapters, but subscap means under. So this sits underneath the scapula, between the scapula and the rib cage. When we go to the posterior aspect, we find the spine of the scapula, and we're going to have the supraspinous fossa, which runs just above the spine of the scapula. And then we're going to have the infraspinous fossa, which runs, I'm really sorry, my cat is extremely friendly. Okay, and then we have the infraspinous fossa, which runs below the spine of the scapula. These will make sense when we talk about the muscles, because these are going to be named for the various muscles, okay? So again, looking through this, we just went through all of this. When you see a scapula, you want to be able to orient. Now, unfortunately for you guys, you're going to have to see the scapula in a lab context, okay? So just remember that you want to find, when you're looking at the sides, so when you're looking front to back, the part that has no raised projection is going to be anterior. So this is the anterior portion. The identifying structure is the subscapular fossa, which is the big space anteriorly. Posteriorly, we see the spine of the scapula. The most lateral projection of that is the acromion. And then anteriorly to the acromion is a raised projection called the coracoid process. You could see the coracoid process anteriorly as well too. You get a nice view of it. And then you want to identify the lateral from the medial aspect. So where the acromion and the coracoid process are, that's going to be the most lateral, because that's muscle attachment for the biceps and the triceps, so big arm muscles. And also you need to identify the glenoid cavity, which is going to be the ball and socket joint at this point. So we know that this is the lateral side, this is anterior, this is inferior. So we have the inferior angle, superior angle. We can see a little bit of the scapular notch here. And then posteriorly, we have the spine of the scapula, the acromion. Above the spine of the scapula is supraspinous fossa, right? This is going to be an attachment for the supraspinatus muscle. And then below the spine of the scapula is infraspinous fossa, which is going to be an attachment for the infraspinatus muscle. And these are your rotator cuff muscles. So as we work our way down, we're going to encounter the humerus, or the main arm bone. This articulates with the scapula proximally, so it's one of your two ball and socket joints, the other one being the hip, and that forms your shoulder joint or your glenohumeral joint. And then with the radius and the ulna distally, the trochlea version is going to articulate with the ulna, and the capitulum is going to articulate with the radius. So I'm going to talk you through the humerus. There's a few structures that you need to know on here as well. So let's look at it anteriorly first. So you do want to identify the head of the humerus and then just the neck of the humerus. They do talk about anatomical neck and surgical neck. My tags for the most part are surgical neck, and you just have to identify the neck. So same thing with the femur. You have to know the head of the femur and then the neck of the femur. Surgical neck is, of course, for any replacements that they do. So if they do hip or shoulder replacements, that's where they're going to cut. And then the anatomical neck is just distal to the actual head. There are two raised projections. There's the greater tubercle and the lesser tubercle. The greater tubercle is the bigger of the two and can be seen anteriorly or posteriorly. The lesser tubercle can only be seen from an anterior perspective. Between the two is called the intertubercular sulcus or groove. That's going to be the house for the biceps tendon coming up. Deltoid tuberosity, we won't be able to do just because we're not going to be able to identify it. And then as we get down to the distal aspect, we're going to see two structures. One is called the capitulum, okay? And the other is called the trochlea. These attach to the ulna and the radius. So we'll talk a little bit about the radius and the ulna. These form your forearm, and they are named for their nerves as well as their location. The way I always remember it is that the radius is going to follow anatomically the outside aspect. So it's going to go to your thumb. So radius to the thumb. If you guys do any EMT or anything like that, then you know that if you're going to take someone's radial pulse, what do you have to do? You have to take your two fingers and push against the thumb side. So if you can remember the radial pulse, then you'll know that the radius follows along the thumb side of your arm. The ulna forms your actual point of the elbow, and the ulna runs along the pinky side. The ulnar nerve that we'll talk about in a couple chapters comes down and rotates around the inside of the elbow. So if you guys have ever banged your elbow really good on the inside here and you banged your funny bone, that's the ulnar nerve that you're hitting, okay? So the ulna is going to run through the pinky side. So the two aspects of the humerus that attach to these two bones is going to be the capitulum, which is rounded, and that attaches to the head of the humerus. And the trochlea looks like a spool of thread. That's how they describe it. I don't sew or anything to save my life. But that's going to be the more medial of the two structures, and that attaches to the ulna portion of things, okay? And then on the posterior aspect of the humerus, all we have to identify is the olecranon fossa, which is going to be where the olecranon, the pointy portion of the elbow, attaches into there. A lot of these, you don't have to get the epicondyles and things like that. I'm not going to spend too much time going through that. So let's look through our humerus. Okay, so here we have Sven's arm, all right. This is Sven's right arm, it looks like, okay. So I'm gonna do the humerus quickly. I couldn't get him apart. I'm gonna have to play around with it. Oh, you know what, I had to take a power drill to Sven. It's kind of screwed in weird. I'm gonna see if I can get it taken apart completely, but for now I'm just gonna keep them together, but I will work on it. So when we come across a humerus, let's start at the top of the head. And I'm gonna try to. So we see the head of the humerus, that's pretty easy. And then we also see on one side, we can identify 2 raised projections, whereas if we look at the other side, we only see the one. So the more lateral and larger of the 2 that you can see back and front is going to be the greater tubercle. And then the lesser tubercle is between the head and the greater tubercle with this intertubercular groove going through. So you should be able to look at these structures, and if you see 2 raised projections plus the head, we know we're looking at the anterior portion of our humerus. So it's head of the humerus, neck of the humerus, lesser tubercle, greater tubercle, intertubercular groove. Then we work down the main shaft. We're not going to do the deltoid attachment or anything like that. And we get to the bottom. When we get to the bottom, so the other thing I like to tell students is when you come across like a humerus or a femur or anything, especially the humerus or the femur, find the head. And we have to know that the head is going to be the medial portion because this is going to attach onto your arm. So see, this would attach onto my arm, which means the head has to be heading towards the axial skeleton. So we know when we come down that now this is the medial side to go with the head, and this is the lateral side. And it's going to line up really well with the ulna and the humerus because anatomically our anatomically, our radius is going to be along because remember, anatomical position is palm forward. So our radius is going to run along the lateral aspect to the thumb, and the ulna will run along the medial aspect to the pinky finger. And that's how this lines up perfectly right here. So here we have the ulna, which is the more medial, and the radius, which is the more lateral. And then we can see our hand at the bottom, and we can identify the thumb and the pinky. So up close, we have, you can see a little bit here. See how this projection is really round? That is the capitulum. That goes to the head of the humerus, which is a little bit flatter. And then the trochlea here, this has a big, they cut it in half, which is great to attach them. So the trochlea here is going to attach to the ulna. The ulna is a little bit tough to see, but the ulna does look like the letter C a little bit. So I remember identifying the ulna because it looks like a C or a U, which goes upright. So if it has the U, it has to be the ulna. And so that is going to form the main elbow joint, okay? So the ulna hooks into the humerus like so, and then posteriorly we can see this pointy part here. This is your elbow. So if you guys flex, right, this is the olecranon of the ulna that you're touching right here. And so we can see that bent, and then when we straighten, see how the olecranon tucks into this posterior aspect of the humerus. This is the olecranon fossa. So again, going kind of quickly through, and I'm sorry, I'm kind of flinging his arms around a bit. So we start at the top, we start superior, okay? We find the head. We can see that there's 2 raised projections, so we know we're looking anteriorly. So the only one we can see from the front is the lesser tubercle. The one from all sides is the greater tubercle. We have an intertubercular groove between them. We have the head of the humerus, the neck of the humerus, the shaft of the humerus, and then we get down to the bottom. And now we identify that this is the medial side. So this is the medial aspect. So we're going to see trochlea first, attaching to the ulna, and then the very rounded projection is the capitulum attaching to the head of the humerus. And then on the posterior side, we're going to see the olecranon fossa. And then posteriorly at the top, we're only going to identify the greater tubercle or the head of the humerus. So that is how the humerus is going to work out. Then we also have the ulna and the radius. So these are our 2 main bones of the forearm. So we have the olecranon and the coronoid process at the proximal end of the ulna, which forms that trochlear notch. That wraps around the trochlea of the humerus and makes the actual elbow joint. And then remember I said radial pulse is going to be thumb side. So if you guys have ever done CPR or a first aid class, you should know that 2 fingers on the thumb side, you're going to push the radial artery against the radial bone to get the pulse. So if you can remember thumb to the radius, then you can always find the radius. And and then you can always find the ulna. This gets tricky because when everything's anatomical, it's okay, but you have to remember that you guys can pronate and supinate. You guys can flip your hands. And so the radius and the ulna are going to cross over each other. So as long as you can always remember that the radius is on the thumb side, then even when you rotate and do palm down versus palm up, you'll always be able to follow which side is the radius versus the ulna. The radius, all we have to identify is the head at one end and then the styloid process at the other. So there's really not too much when we look at our radius and our ulna. Here we have a nice close-up of the ulna without anything in it. You can see how it kind of forms the letter U. So that's how I always remember, or the letter C, however you guys want to look at it. I like U for ulna. And so we have the more prominent area, which is going to form the actual pointy elbow. That's the olecranon. Anteriorly, that's going to be the coronoid process. And then the little U shape is called the trochlear notch. At the distal end of the radius and each ulna, you will identify what's called the styloid processes, and they're both styloid process. So on an exam, if I tag one or the other, you just have to get styloid process down. Those you guys can feel on yourself. So the raised projection that sticks out on skinny people here on the pinky side, that's the actual styloid process of the ulna. So not the wrist bones. So this raised projection, when you touch it, and you can see when you flex your wrist, it doesn't move because it goes with the ulnar bone. Same thing on the other side. I'm not skinny enough for it, but you can also feel a raised projection on the thumb side. And again, that's the styloid process of the radius. So that is identifiable pretty easily on your own bones. So again, we have the ulna and the radius. These are connected right now, but on an exam they might be isolated bones just from the pictures. So looking at the radius first, because it's the easiest, proximal, so closer to the shoulder joint, we have the flat rounded head of the humerus. Then as we work our way distally, we've got the styloid process of the radius. On the ulnar side, we are going to have the olecranon, which is posterior and forms the actual elbow projection, this coronoid process anteriorly, and then we can make out the trochlear notch, which the trochlea of the humerus is going to sit in. And then as we get distal, we can see, oh, they got a really crummy one on him, but you can see a really small styloid process on Sven here. It should be a little bit bigger. And that's going to be it for the radius and the ulna. I'm not going to ask about the radial tuberosities or anything this semester because unfortunately we just don't really have access to them. Okay, and then lastly, we're going to finish up with the carpal bones and then the digits and the metacarpals. So with the carpal bones, we have 8 small bones. Carpal means wrist, so now we're in the wrist. They're going to be arranged in 4 rows. The proximal row, which is closer to the radius and the ulna, are going to have the scaphoid, lunate, triquetrium, and pisiform. And then the distal row is going to have your trapezium, trapezoid, capitate, and hamates. Okay, that articulates with the actual metacarpals of the hand. And then as we work our way down, you're going to have 5 metacarpals. These are in the palm of the hand. They make up the palm and the back. They're numbered 1 through 5. 1 is always the thumb side, and then 2 through 5 is the fingers, and they're going to articulate with the phalanges. The phalanxes are in the fingers and the toes. So within the fingers and toes, there's 14 total, and that's because in the thumb, there's only 2 phalanges. There's a proximal and a distal, whereas with fingers 2 through 5, we have a proximal, middle, and distal phalange. And that we can see on here. I'm going to talk you through the wrist bones. I'm going to try to figure out how I can get this to you guys so you guys can fill it in. So here we have, I like the anterior view. So the anterior view is palm up, okay, because we can see all 8 carpals very well. When we do a posterior looking at the back of the hand, the pisiform is hidden. It's a little bit harder to see. So you only see 7 of the carpals posteriorly. So I like the anterior view. So here we have the anterior view. Here we have the radius coming down with its styloid process. Here we have the ulna on the pinky side with its styloid process. And so then we have our 4 carpals on the proximal row and our 4 carpals on the distal row. And then we get into our 5 metacarpals. So it goes scaphoid, lunate, triquetrum and pisiform, trapezium, trapezoid, capitate, and hamate. The way I remember this is if you start with the scaphoid, which is on the thumb side proximal, it's some lovers try positions that they can't handle. So some lovers try positions is the 4 carpals on the proximal row that they can't handle is the 4 carpals on the distal row. So we have scaphoid, then we have lunate, which is kind of a moon shape. Then we have triquetrum and pisiform. It's hard to see on this picture, but the pisiform is actually a round P shape. So it's a perfectly round bone. You guys can actually feel it a little bit because it's on the pinky side. So after you come off the styloid process, there is usually like a little rounded ball kind of near the base of your palm. And that's usually the pisiform if it's not connected onto the actual radius itself. That they can't handle is trapezium, trapezoid, capitate, and hamate. I remember trapezium because trapezium touches the thumb, so zum and thumb, and then trapezoid goes next to it. So with the 3 T's, it's trap and trap right next to each other. So trapezium to the first metacarpal or thumb, and then trapezoid right next to it. And then capitate and hamate has a little hook on it that you don't see here, so I remember it as the hook of the hamate. Okay. And then we have our 5 metacarpals, and then we can see our phalanxes here. So see on the thumb, we just have 1 proximal phalange and then 1 distal phalange. Whereas when we look at the other 4, we have a proximal, a middle, and a distal phalanx. And that you guys can see when you turn your finger, right? So this would have been the proximal phalanx. This is the middle phalanx, and this is the distal phalanx. Whereas on the thumb, we're not going to get that, right? We only get the proximal phalanx and the distal phalanx. So let's work through this a little bit. Okay. Here we get to the bottom of the wrist. So this is our, like I said, right hand. So it does line up with my right hand. You can see it. There we go. Here's my right hand against this right hand. So we know we're looking at the right hand. And then we'll start with the metacarpals. So 1, 2, 3, 4, 5. So this is the palm of the hand. And then the phalanxes. So thumb, we only have 2. So proximal and distal. And then remember that we can see on here. So we can see a distal phalanx and a proximal phalanx. And then we hit a metacarpal right off the bat. Whereas on our 2 through 5, we have proximal phalanx, middle phalanx, distal phalanx. So we get 3. So proximal, middle, distal phalanx. Then we got the metacarpals. And lastly, we've got the wrist bones. I'm going to show this to you from the side, and I'm looking at it reverse. So let's see how I do. So remember, it's some lovers try positions. So we start on the thumb side. So we have proximal row, scaphoid, some. Lunate is hard to see, but it is kind of moon shaped. And what they always do on these models is they take the triquetrum and the pisiform and pretty much glue them together, which they did here. So triquetrum and pisiform, which is this little ball shaped one. So scaphoid, lunate, triquetrum, trapezium, triquetrum, pisiform. Then it's the next row is that they can't handle. So remember, trapezium goes to the thumb. So this is trapezium. Then next to that is the trapezoid. So trap and trap, trapezium, trapezoid, can't, which is the capitate. That's this big one. And then you can see if you look really close on here, This bone that attaches to the pinky has a little hook on it. That's the hamate. That's the hook of the hamate, not to be confused with the pisiform bone. So you should be able to work through these 8 carpal bones. You do need to identify these 8 carpal bones, and I always have at least 1 or 2 lab tags on them. So make sure that you can identify them. The mnemonic helps, and then just kind of practicing them over and over. So again, scaphoid, lunate. So this is proximal row, and we start on the thumb side, which means we start on the lateral side and work our way medial, right? So scaphoid, lunate, triquetrum, pisiform, and then we go to the distal row, which attaches to the metacarpals. And again, we start on the outside, trapezium to the thumb, trapezoid, capitate, and then the hamate, which has a big hook on it. So you should be able to work your way through those bones. When I tag the bones, they will always be attached. Okay, so all 8 will be together. I'm not going to pull them apart or anything. There's not just going to be a capitate laying out that you guys have to identify. So when it comes to tagging anything on the hand or the foot, everything will be attached in its full integrity. Okay, so you don't have to identify phalanges or anything separate. Now the rest of these, humerus, ulna, and radius, they can be disarticulated for the lab exam as well. So I can get just an isolated photo of them, and then you'll need to be able to identify them in some of their structures that I've talked about here based off of just looking at the bones themselves. So it's very important to orient. So find structures on the bones that you can orient to. For my purposes, the heads are always easiest, and then I know that those have to go medial because they have to hang on the rib cage. And then things like we talked about, the greater and the lesser tubercle. The lesser tubercle you can only see from the anterior portion of the humerus, so we know that we're looking at the front then. So when it comes to these bones, I do, whenever I come across them, and I tell this with every class, just identify the bone first and orient yourself to the bone. Now, in lab exams, normally you guys would be able to walk around and pick up the bones and make it a little bit easier. We're going to have to do this just based off of slides, so it'll be a little bit trickier, and I will not be leaving the anterior and posterior options that are tagged at the bottom of the page. So it's just going to be the bone as it is based on the cartoon pictures in the lecture and the lab book. So you need to make sure that you can identify certain structures on the bone. That's going to tell you which side the bone is on, and then also if you're looking at the front or the back of the bone, and from there you'll be able to name the structures and identify things a lot easier. So always make sure when you come across a bone that you can put those 2 in order first, and then that's going to help you to identify the tag on the bone. Okay, that's going to be it for the arm right now. I'm going to come back and talk about the lower hips and the lower leg. And then from there, we're going to put together a few more videos. I have a couple of CDs, and I'm trying to figure out how to put them into different computers and see if I can share the screen, because unfortunately I do this on a MacBook, which does not have a CD player. But I am going to try to find some ways to help out you guys with understanding everything that comes with the bones at this point. And then we're also going to get chapter 6 down this week, which is going to be the bone tissue. Now that's not anatomy so much as it is physiology. So that's bone growth and what happens when we break a bone, and then bone growth in utero as well. So once you're born, how the bones develop over time and growth plates and things like that. And then after this week, we're going to get into muscles, which are going to be on the next exam as well. And then the physiology, muscle tissue that goes behind it. So stay tuned for the lower half of the body, and then that's going to be all 206 bones. And then it's just a question of us coming back and reviewing them consistently until the exam, which is in a few weeks. I'm going to have it the week before Thanksgiving break. Okay. So stay tuned. I'll be back for the lower extremity.